The Sheriff's Office, along with LCPS and the Department of Mental Health, hosted a presentation to talk about the opioid that has been getting in the hands of young people, not just in the DMV, but across the country. Fox 5's Aisha Khan shares what was learned at Parkview High School in Sterling, Virginia.
For decades, the message has been say no to drugs. But today, the risks of overdose and death are so much greater with easy access to drugs through social media and the absolute flood of fentanyl across the country. Daily headlines telling the story of young people either overdosing or dying from the drug.
Actually, I lost my son to fentanyl, my oldest son, in 2021. So my mission is community awareness and advocacy for other children. So we have less in loss of life. And I have a child in middle school, have a child in college. So the more that I am aware of the problem, the increasing problem across the DMV and beyond, the more I can help others. The main goal is to prevent loss of life.
There's a 70% chance that that pill has enough fentanyl to kill you.
Saturday morning at Parkview High School in Sterling, Virginia, a community of concerned parents, students, educators, and the Loudoun County Sheriff's Office came together to address the growing crisis and what can be done to put a stop to it.
It's important that people know how serious this is and how deadly this drug is. We need to make sure that everybody is engaged here in the community.
The presentation comes at the heels of fentanyl taking hold at Parkview High School after 9 students overdosed just within the last few weeks.
As soon as we realized that this was a trend, when the sheriff brought it to our attention, we acted swiftly within 3 or 4 days to make sure that we had a task force ready, that we put communication out to all of our families in Loudoun County Public Schools.
The objective of the presentation was to provide valuable information about the dangers associated with fentanyl. That included an overview of what fentanyl is, what it looks like in a pill form, and what authorities are seeing with teens.
We can't use euphemisms to describe what's going on with the problem. We've got to be very direct.
The presentation also provided opioid overdose reversal training and how to pick up on the signs of an overdose, as well as to how to respond to it and administer naloxone.
Narcan, naloxone certainly is an antidote. Doesn't, sometimes it takes more than one dose to do that. We don't want that to be a crutch for people. We want them to just not do it at all.
For many families and individuals, the cost of losing a loved one to the opioid crisis is more than just a realization about how dangerous the drugs can be.
It affected my family when my brother died. I would love to see just all end, honestly.
I hope to walk away with being able to tell my friends and my younger siblings and cousins that you shouldn't do drugs, it's not good for you, and if you need help, there are people out here who can help you.
Reporting in Loudoun County, Aisha Khan, Fox 5, DC.